Hello, 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 everyone. Welcome to another episode of Sree's Global Pandemic Show. We talk about various aspects of the pandemic, and we are at episode number 294. WHO Explains Omicron. We are honored to have with us Dr. Abdi Mahamud, who is a global incident manager for COVID-19 on the Incident Management System team. He's a former WHO Pakistani national team leader for polio eradication and a medical epidemiologist for the US Centers for Disease Control and a medical officer for the Kenya Ministry of Health. He'll be joining us in just a minute. Hi, everyone. I'm Sree. I'm the Marshall Loeb Visiting Professor of Digital Innovation at the Stony Brook School of Communication and Journalism. Thank you so much for being here. We're live on Facebook, on Twitter, on YouTube, and on LinkedIn. Today, we have a very special show at a very special time because we are in the middle of the cases around Omicron, the variant that is having such a big impact around the world. And I'm honored that we will be joined today by one of my dear friends who will help us do the interview with Dr. Mahamud. Our guest will be Dr. Sujana Chandrasekhar. You see her here as part of the dynamic duo of Dr. Sujana Chandrasekhar and Dr. Marina Korean. Their show is called She's on Call, and it's on Sundays at 11 a.m. Eastern Time on Facebook, on Twitter, on YouTube, and on LinkedIn. And you can watch the archives on those social platforms. And Sujana is here today to help me do this interview. So let me say hi to Dr. Sujana.
Hello, Sree. How are you doing today?
I am looking forward to this conversation, Sujana. I have so much to learn from you and from Dr. Mahamud. There is so much going on. Let's set the table for everybody. Let's tell them some of the headlines that we've both noticed. I noticed that Davos, the World Economic Forum, has postponed their annual conference, the famous conference in January in Switzerland, to later in the year. We've seen Moderna announce today that their booster is effective against the variant. We have also seen news about problems with other vaccines may not be as effective. So those are just some of the headlines I noticed. What about you?
Yeah, I noticed those things. I noticed that the case rate in New York, New Jersey is doubling and tripling on an every 2 to 3 day basis. So we're seeing the increased virulence or the increased spread with the Omicron variant compared to, let's say, the Delta variant. I'm seeing the news about the difference being between what the CDC, what the United States Center for Disease Control calls fully vaccinated, which is either 2 mRNA vaccines or 1 Johnson & Johnson vaccine. The difference between that and having a booster shot is really remarkable in terms of the person contracting the Omicron variant of COVID now. And of course, people who are not vaccinated are acquiring it at very high rates.
Thank you for that. We are meeting on Monday, December 20th. So if you're joining us later, this is the moment. We just want to capture this moment of Monday, December 20th. Our guest is standing by, and we're very excited to have him with us because it's so important that we understand as much as we can. Our guest is Dr. Abdi Mahamud, who is on Twitter at Dr. Abdi Mahamud. Please follow him. He's Global Incident Manager for COVID-19, and he's on the Incident Management System team. He's a former WHO Pakistan National Team Leader for polio eradication. He's worked at the US Centers for Disease Control and has been a medical officer in the Kenya Ministry of Health. We are so grateful to him for joining us in the middle of everything that is going on. So let us say hello to Dr. Abdi. Hello, Doctor. How are you?
Thank you so much, and my apologies for joining late. We had another engagement. Pleasure to be with you and your team.
Thank you for being here. We should just say that you're coming from the press conference of the Director General of WHO, talking about what's happening in the variant right now. So very grateful to you for being with us. And this is my colleague, Sajana Chandrasekhar. She's a surgeon, specialist in ENT surgery in New York. And we are just grateful that you would make the time for us. So if you can give us a couple of headlines, you also brought some slides that we can show as well. But thank you for being here, Doctor.
Thank you. As you know, as maybe I just joined the discussion late, we are still in the midst of the Delta wave that has taken a lot of many loved ones from us and from a lot of families. All in the US, almost 99% of the cases are still Delta, and Delta is the one right now top killer. But as we are in the middle of the surge of the Delta, we had a new emergence, a new variant that came on 26th November. WHO classified as a variant of concern. And that means that countries need to prepare for what's coming, the next wave of another variant. Thanks to the South Africa team, who have been very gracious for immediately sharing the data with us and alerting, and for Botswana and a lot of that. So it's the global solidarity and the science is going to help us defeat this pandemic. We're in together, whether you're in India, in New York, or in South Africa, or any part of the world. It's one pandemic that's affecting the whole humanity family, and we need that solidarity to approach. As of now, we're still validating the number of countries reporting, but over 90 countries have reported, more and more are. But we can safely assume almost every country that has sequencing and has open borders, because some of countries are still restricting borders, the variant may be there. Some countries have wide-scale community transmission. We have seen that well established, and it's coming more and more. The US CDC have reported a number of US states that are reporting the confirmed Omicron variant of concern. Where here I am today, I'm visiting the family in the UK. I think more and more cases, half of the cases are Omicron. So we are seeing a different picture, as it's going to be, well, the hope is still there that we have the best tools that can save life and more, and that is vaccination. If we vaccinate more people, and that's how we're going to reduce hospitalization and death. So we do have tools that have worked that work against Delta, that have worked against Beta, still going to work against Omicron, and that is the personal responsibility. What we do as individuals, as community, and as society can have a major dent in protecting our vulnerables. So our main message is the tools that we have still work. And that's
so Dr. Abdi, it's such an honor to meet you. And I've followed your career, and you really embody the principles of public health. So I want to thank you from a grateful world. We've talked about masking, and we've talked about social distancing or physical distancing, and we've talked about vaccines. And this summer here in the United States, where there was a big increase in vaccinations, there was some mixed messaging regarding removing our masks and how distant we should stay. It's still an airborne virus. And so now we're seeing the Delta, which, as you said, is unfortunately much bigger killer, as far as we know, than the Omicron variant. But we're seeing huge surges in what we believe is an Omicron variant in people who are either vaccinated or even have had their booster. Can you talk to us about how effective the vaccines are proving, the ones that are approved in the US and UK and elsewhere?
That's the $1 trillion question. I mean, when we go back, if we take some step back, when these vaccines were approved on the main things that the end goal was to reduce disease, hospitalization, and death. We had such an excellent, very good new platform of vaccines that came into the vector vaccine and the mRNA. An advantage of those vaccines from early result was they also have a major impact on infection. So we talk about, I think we have to unpack for our audience, we talk about infection, that you get the virus and it will replicate in your body. With that, you have the demonstration of the disease, that you get chest infection or that. And then some of those, a proportion of those people who got infected the disease can get worsened and hospitalized, and a small proportion can get sadly die tragically. So looking at that, so the vaccines were designed to reduce the severe form and hospitalization. So having a new platform had the advantage of reducing the infection. So once there was initial data that came out that these vaccines have an impact in reducing infection, a lot of people relaxed. But what we didn't put in the consideration was this variant that came. So a highly transmissible or a highly efficient, let's say highly fit, because fitness variant came that was Delta. So Delta, once we had in the midst, we went back again and said, what's the impact it has? And now with Omicron coming out, we are back into the drawing board saying that what the vaccines, let's go back to the initial goal of the vaccines, what they were designed for, and that's to reduce hospitalization. Studies from the UK and from South Africa have clearly shown that the impact on infection has drastically gone down with the vaccines, so it's from 30% to 40%, while the vaccines are still preventing against you developing a severe form of the disease, that hospitalization around 70 to 80%. So the vaccines are still intact, and they're going to save people's life, and they're going to prevent people from being hospitalized. Their role in infection is getting really still the jury's out there, but we know more and more because of the reduced neutralization antibody. So what we are saying now, and everyone in CDC is saying, or in the public health, is your personal protection, whether you are vaccinated or not. Please protect yourself, mask yourself, avoid crowds to protect yourself and your loved one while getting vaccination.
Yeah, I think that is a message that is really important for people to hear. So I think what happened is people got vaccinated, let their guard down, let their masks down, and then we're seeing that the virus, like you have a beautiful slide about how viruses evolve over time, and maybe Sree, we can share that, and Dr. Mahamud can talk to us about why the flu shot is different every year, why the COVID situation is not stagnant for us.
Yeah, thank you. And I just wanted to bring to the basic knowledge biology, going back to our biology classes, all virus or even all life evolve depending on the time scale. Viruses are just in minutes and seconds. So with the expansion of genetic sequencing now, every variant and every molecular chain is being monitored because we're in the midst of a global pandemic. So what you see in the upper part is the Delta. So the vast majority right now where we're dealing is still Delta. Down there you have a small red blink that's coming from nowhere, but it's gaining more speed and more fitness. So I just wanted to show the same objective of SARS-CoV-2. What we are seeing is not unique to SARS-CoV-2, all viruses, but the rate they mutate the changes. So I put here the seasonal flu, which every year we see new ones, and we prepare. We have enough evidence for the last 10 years. We've been monitoring. We know where it's coming from the southern hemisphere before it goes to the northern hemisphere, what's circulating. We can prepare better and have vaccines. So that's the seasonal flu. It's not that the comparison where the flu and SARS-CoV-2, no, SARS-CoV-2 is a very dangerous, deadly disease that's taken 5 million people so far that we're aware, and more people we are not aware. But here, what I'm trying to show is that viruses do evolve, and we can prepare ahead of advance and adjust ourselves. So when the body is exposed to a virus, we have a fantastic immune system in our body that can address this. Say, you are the enemy, I'm going to prepare for you, I will fight you, and then I will keep a record of you, what we call a memory. So the next time you come, I'm ready to defend against you. So the vaccines, I think a lot of misinformation has happened what the vaccines can do or not. Vaccines use the natural body system to prepare who the enemy is. So that's why we really require everyone to get vaccinated, and for those vulnerable populations, depending where you are, to get the boosters.
Yeah, I think that's really important, and I appreciate that you made a point that you are not equating SARS-CoV-2, which is the causative virus of COVID-19, to the flu, but you are showing that things do change, and to stay abreast of the scientific knowledge is really important. You talked about the current global situation, which is really bad, and we've covered both on Sree's show and on She's on Call. We've covered, the different vaccination rates around the world. But can you tell us, we do owe a debt of gratitude to South Africa and Botswana for identifying the Omicron variant and sharing that knowledge, generously with the rest of the world. The climate, the literal climate, is cold now in Europe and in North America. What do we expect? Do we expect a relatively limited course with Omicron, or can we not say what that will look like?
With thanks to the scientists from South Africa and England, we have enough indication that this virus is a more fitter virus. It is the growth that is increasing. The doubling time is almost 1.5 to 3 days. So it's a matter of calculus or geometrical exponential growth. That the graph that you showed in South Africa is almost vertical. What we haven't seen any so far in all the variants we had. So in areas, if you look at down there, Africa was going slowly, and then almost like a vertical growth. That timely growth, that the 44% on a daily increase. Today you have 2 cases. Tomorrow, within 1.5, 3 days, your case will be double. So you can imagine in 2 weeks' time, in Europe, the prediction is it will be the main dominant variant. And with the US, we may see the same. How it's going to play out between Delta and Omicron, no one knows. It's from early indication that Omicron is a more fitter variant, that it has a potential of, for those people who have been vaccinated and or got the infection, maybe the immune has advantage over that. So we may see a different picture as we move. But what's more important is what we do during this winter season. People come together, they get together, and we have the holiday season, the New Year, Christmas, and a lot of holidays happening. So the more we gather together, we give the virus more chances to spread further. So we really need to get vaccinated and keep our mask and our distances. Sree?
Thank you very much, folks. If you're just joining us, we're having a conversation with the leading expert on what's happening in the world right now, in the world of Omicron. This is Dr. Abdi Mahamud, who is with the World Health Organization's COVID-19 Incidents Response Team. Thank you so much for being here. And that's Dr. Sujana Chandrasekhar from the awesome show She's on Call. And we are talking to him, trying to understand what's happening. We have comments from all over the world, and we have some questions that have come in, Doctor. So we're going to ask them of you, and then we'll come back and forth as well. We'll just look at some comments first. Kanika says she's excited for this episode. Thank you. Jonathan's watching from the East Village in New York. Linda's watching from Long Island. And we have several questions that have come in. Rahajan is also watching from Long Island. And Neil Parekh, who's part of our Digimentors team, says such an important, so timely. We're all thinking about this and trying to figure out what the next few months will bring. And he's watching from Springfield in Maryland. Miriam is watching from Hell's Kitchen. Hope this will be up for a while. I think she's talking about the slides. We'll repeat them, and Dr. Abdi has brought many slides for us. So let's go to one of the questions that has come in. Well, first, Nishit says hello from New Delhi, and Ravneet already says thank you. So you're already helping people. Miriam's question, one of the things I don't see much about is the spread outdoors. Can't droplets hang in the air? Is Omicron so transmissible? It seems we should all be masked outdoors as well as inside. So Dr. Abdi, over to you.
Thank you, Miriam, for that. A good question. I think what we have seen from Omicron and Delta and all the variants, that the distance makes a lot of this, makes major impact, and the ventilation. So if you are in a well ventilated room, the risk of that aerosol when they come out reduces. Outdoor, while we like outdoor, we haven't seen any major outbreaks. Of course, if you go close to someone and you sneeze on someone's face while outdoor, you can get it. But the dilution factor in outdoor is very important. It reduces the risk. So basically, it's about the risk reduction. In an outdoor crowded settings where people are protesting and shouting, could be a potential risk. So what we see more and more is the indoor where people are crowded. So opening the window, making sure people keep their distance is very important. Do we need to mask outdoor? The available data does not show that Omicron is more changed. What we are seeing more and more than the intrinsic virus, it is ability to sneak around our immune system, what we call the neutralization antibodies. So the body has two defense systems. One is the initial guard that when it's attacked, starts shooting, and the other one is specialized forces. So the immunoglobulins, antibodies, and we have the T cells. So we see dramatic reduction in terms of the antibodies, while the T cells that defeat the virus are still intact. So to coming back to your question, we don't have enough indication to tell people they need to wear mask when they're in the park or anywhere outside that's well ventilated, but always is a distance. When in suspicion, protect yourself, because it's really relatively risk where you are and how to be. So when in doubt, always mask. If there's a situation that you feel like you're uncomfortable and the risk is more, please mask yourself, protect yourself and protect your loved ones.
I have two doctors here, so I'm just going to ask Dr. Sujana, who is an ENT surgeon, wears a mask for hours of surgery. Can you please debunk the myth that there is oxygen problems and other things that come from wearing the masks?
I'm happy to do so. Not only do I wear them for hours of operating, which hopefully your surgeon and your OR team is fully oxygenated while they are operating on you. But since the pandemic, we've been wearing these masks, all day long. I've been wearing them to see patients all day long, talking to patients all day long. And there is no buildup of carbon dioxide or carbon monoxide. There is no reduction in oxygenation to my blood because I am wearing a mask. What there is a reduction, a dramatic reduction in any infection that's airborne that I can spread to you or that I can acquire from you that comes in through my mucous membranes, through soft things. So my mouth, my nose, my eyes are all moist. And if I'm wearing eye protection and a mask that fits properly over my nose and under my chin as sealed at the cheeks, then my risk of contracting something from you is dramatically reduced, and I can be close to you to examine you because I'm an ENT surgeon, so I have to examine you. And then your risk of getting something from me is dramatically reduced. So there is no downside to wearing the mask other than, I guess, lipstick sales reduced during the pandemic.
Dr. Abdi, your thoughts?
No, absolutely right. I think there are a lot of cultural things that are more uncomfortable than a mask. Men, we put on a tie, which is really uncomfortable, and there's no any added benefit of putting on a tie. I think if you ask, none of us are tied, but when we go to office, I do still put on a tie. There are a lot of things that we do because of cultural, because of expectations. Here is a simple tool that can help you and other people. So I think it is, we are not saying put on N95 wherever you go. It's a 3-layered mask or a surgical mask. And that has a really studies more have shown that. So excellent. I hope it is a 3-layered mask.
I'm not sure, but this is a Doctor Who mask. So now I'm also a doctor like the two of you. We have lots of questions and very little time with our doctor, so let's just move on. A question from Unikri says, we clearly see the virus is mutating. Does vaccination lead to fast mutation of this virus, doctor?
No.
No, absolutely not.
Okay, that's good.
So the viruses mutate in host bodies, primarily non-vaccinated, where there is room for them to change. So once we're vaccinated, we actually also reduce the development of new and more fit or more virulent mutations.
Thank you. Doc, we also have a question about trying to understand the difference between the people who are unvaccinated, vaccinated, boosted, and those who have had COVID. So let me give you an example of just me. I've had the 2 Pfizers plus the Pfizer booster, plus I had a mild case of COVID in August. What are the dangers for someone like me?
Danger in terms of? Yeah. Danger in terms of?
No, like at the moment, how worried should I be? I am paranoid all the time. Should I be as paranoid as I am? Because I've had 4 different encounters with the virus, right? 2 vaccines, booster, plus COVID itself. What do you say to someone like me, doctor?
We call them the super immune people. So you're kind of, every time your immune has been exposed again and again. So I think for you, there's nothing, we don't know what's going to happen. The South Africa data has shown there are people who got 4 times reinfection. So the immune is individual based on the virus and the environment you are. The danger of you getting again, it is limited, but there's, in science and in biology, there's nothing absolutely. But we know very well people who got infection and got immunized have a better outcome even with Omicron. So you are the neutralization body in you is higher than compared to me who has received only 2 doses. But that is depending on your age, on other underlying factors. So if you don't have any hypertension or any other disease and you're a healthy person, your immune system gets improved. But if you're senile or if you're elderly, your bone marrow, as your bone gets weaker, so is your bone marrow becomes thinner. That's why a lot of the biggest risk factor for this was age. So for you, don't let down your guard, keep masking, keep protecting, because you can also pass to other people.
That's a big question, of course, and very important. Thank you, Doctor. We have a question about South Africa from one of our viewers. And so we have your South Africa slide. So please explain what's happening in South Africa. And is there long COVID? I mean, this is so soon, but is there any long COVID associated with Omicron?
Thanks to the South Africa team. I think they have an excellent scientists there, and they've been sharing the data openly. Unfortunately, some countries reacted negatively and punished. What we are seeing here on the left side is the cases. So the 3rd wave, that's the Delta wave they had, and they were coming, everyone relaxed, and immunization going on speedily, and then all of a sudden Omicron came, and that's a vertical rise that you're seeing that's related to Omicron from mid-November. On the right side, you see the hospitalization. Hospitalization were going down literally around 120, and you can see slight uptick. Always there's a delay between the cases on the hospitalization and the death, because this is a lag period. And particularly in the Pretoria area, Johannesburg, is where we are seeing more and more hospitalization. So basically, sharp increase in cases in the context of a big wave of Delta and an increased hospitalization, increased vaccination. So a lot of people got infected suddenly, but a good number of them also got vaccinated, and Omicron came. So we are seeing a kind of a diversion between the hospitalization, or there is a delayed, it's catching up with them. So the idea that Omicron is milder, I think it is too early to say that. Hopefully, let's hope it's not a strategy, but hopefully if you're vaccinated and you got again, it will be milder. But it's too early to say whether Omicron will be less milder or it's more high risk, the more virulent than Delta, we don't know yet, but it happened in an area that has a big wave of Delta and a relatively higher vaccination rate.
Thank
Well,
you.
we did-
Sumedha says hello from New Delhi, India. Deborah's watching from Fort Lauderdale. Stefan says masks work. Masks work. I haven't had a cold in 2 years, not even the sniffles. Let's all get with the program. Protect others by masking properly, not just yourself. And so many questions have come in. Sumedha is asking a question. AstraZeneca vaccine is said not to have any impact on Omicron. Those who aren't vaccinated, should they get AstraZeneca vaccine for Delta, or should they not if it's not worth it with Omicron? So that's also some confusion we have. So your answer, please, Dr. Abdi.
Thank you. And I started again differentiating between infection and hospitalization. Almost all the WHO approved vaccines have been approved to prevent disease and hospitalization. So far in the UK and all other data is showing that these vaccines are still doing what they were authorized to do, and that's protecting you from being hospitalized and getting severe death and by extension death. So these are misinformation going on. There's no advantage. The advantage maybe it can protect infection, but AstraZeneca and all the vaccines that we have are still protecting you against severe form of the disease and hospitalization. So please get the vaccine that's available. Don't wait the dream that because before you get, while you're waiting there, you might get the COVID.
Thank you. Dr. Sujana, you have a question.
That is incredibly wonderful advice, right? So don't hold out for some unknown thing that may or may not occur. What we really want is we want to tamp down the severity of the disease and the deaths from the disease, overrunning hospital systems. I know Dr. Mahamud knows. I mean, healthcare workers are exhausted. It's been 2 years of confronting this illness and, being exposed. And so I think all that we can do to prevent having to go to a hospital because we are so sick from COVID is going to help us and going to help our communities. And what does that mean? It means getting vaccinated, and here in the United States, we have access to boosters. Get your booster. That's really important. The South African data showed that just having had the disease before did not protect you. So that protection does not last very long. So you really do need the vaccine, and where you can, the booster. Keep your mask on and be very cautious among the most vulnerable. So people in nursing homes, elderly people, people with underlying illnesses like diabetes, high blood pressure, asthma, bronchitis, and very young people who can't, small children who can't get vaccinated. So I think showing concern for our neighbor is really what I hope that the world has learned from this pandemic over the last 2 years.
Thank you both. Folks, if you're just watching, we are live on Facebook, Twitter, YouTube, and LinkedIn with one of our guests from the World Health Organization, Dr. Abdi Mahamud. This is our 6th episode with his colleagues over the last 2 years, and we have learned so much every time. Vasanthi asked a question about the virus in certain animals. We know that one of the ways in which the theory of how this came to human beings was the jump in the wet markets in China. And what is the danger for the virus could jump back and forth and mutate further, Dr. Abdi?
Thanks for this excellent question. And there's an area of research that WHO, with the partner, we have been working very closely with the others. So we've been monitoring very, very carefully. As last year, if you have heard about the minks in Denmark, there's a massive outbreak that happened, and almost all of them, the government decided to cull. So yes, it's possible. And one of the theories that might have explained was the spillback event, that a virus goes from a human being to an animal and then comes back. To explain this number of mutations in Omicron, that's one of the theories. So the team has been really, really looking at that and doing that investigation. But so far, I think the main question is allowing certain part of the population not vaccinated. So a normal healthy person can get the infection and you can clear, your immune system can clear it immediately within 2-3 weeks. But if you are immunosuppressed or you have malnourished, if you have other things, you shed the virus longer for long period in one person, and it can mutate. So the idea of vaccine equity, it's for everybody. So once instead of getting the natural infection mutated in you, is to protect you with the vaccine, to protect that individual, but also to protect ourselves and the whole world, because those vaccines mutation arise in areas where there's a poor vaccination that are gone. So almost every other one is coming from one of the hypotheses is that a long immunocompromised patient who has not been protected is shedding the virus longer period. So thanks for the question. It's an area that we're closely monitoring.
Can I ask you, Dr. Abdi? There was some posts on social media that veterinarians are finding that the shedded virus is in the fur of the animals that they're taking care of. So from their humans to the fur and then aerosolized at the veterinarian's office. Are you seeing any of this? Is the World Health Organization concerned about that?
We haven't had that, but we know that the close contact, what form of aerolization that happens, anywhere that you have close contact with those ones. So there's documented many animals, from pets, from other wild animals, deers, for example, recently in the US and North America. So it can happen, and all modes of transmission, it's possible, and that's why when you handle the animal, you have to take the necessary precautions.
And so if you have animals at home, if you're taking them to the veterinarian, I think the veterinarians and their staff are using the type of precautions that human doctors are using as well.
Yeah.
One of our She's on Call viewers asked if there is a way to, in addition to all that we've talked about, to improve your immune status in this time. Dr. Abdi, what's your answer to that question?
I think the first one that's available for everyone that can train, because there's a general idea of boosting your immune system, which absolutely we need to exercise, we need to keep healthy, stress, all the things that the physical, social, mental. But the first best way and the shortest cut is to get vaccinated, because we need specific soldiers that gonna protect us against this. While the general army may be good, you need detective that will detect the person who's gonna come and rob your door and take the loved one from you. So absolutely right that we need to reduce all these layers, is all the unmet health needs, from the disease like hypertension, disease like diabetes. These are all lifestyle modification, and we have to use this pandemic to make some newer resolutions to make a difference on that. It's in our own hand, our health, we have the choices we can make. So sleeping better, sleep is very critical, important. Connecting with your loved ones. I know we can't travel, but at least calling them, the psychosocial support that's required. Reaching out to your neighbors, I think you alluded to that, very important. We are social beings and we need to be part of the community. So while we build the overall, our well-being, I think the immediate one, vaccination will help us to have a specific defense against COVID-19.
Thank you so much. We have lots of questions, so we're going to do short questions and short answers. Tim is pointing out in Pennsylvania that so many bus drivers have COVID that the options are for parents to do Zoom with the children, to do Zoom or drop them off. No buses available at all. We also had a comment from Deborah Kerr about a cruise ship of 42 people infected, the world's largest cruise ship, 6,000 people then got off that ship. Dr. Abdi, what should have been done by the company to keep these people now from spreading it? It feels like it's March 2020 all over again.
Yes, it's back to Diamond Princess. No, I think It's multi-layered protection. That there's no one magic bullet that if you do this, you can reduce. So it's from the ventilation, from the masking, from testing, from reducing the gathering. So it's a multi-layered approach that we can reduce the risk, because I don't think there's only one thing. If you do this, if you vaccinate, I think we're being criticized saying vaccination because we know very well the current vaccination, while saving you from severe disease, will not have a major impact on infection. So that's why we are calling again and again for all these multi-layered protection approaches, rather than relying on only one tool. We have multiple tools. When you're making your biryani, you have to use all your spices. So don't rely on only salt. So make your protections to be layered. That's what we trying to say to everybody. Don't rely
like
on
a curry
one tool.
or like a tagine in Morocco where they do that, right? That's very important. Deborah's pointing out 6,000 people disembarked in Miami. So maybe people shouldn't be going on 6,000 person cruises. It's crazy. Rafiq says, I was vaccinated with 2 doses of Sputnik. I guess that's the Russian vaccine. What is a compatible booster shot, Dr. Abdi?
It depends where you are, Rafiq, and which country, because the policy from one country to another, it's very hard for us to give an advice. But any vaccine that's available and that's recommended by a national in the country you are, will follow that. So it's very hard to say this vaccine, do that and that. But I'll leave it to your local clinician and your local healthcare worker to advise you on that.
And Dr.
I think actually, yeah, that's really important. It's actually very nice that you can mix and match your original vaccine and your booster. And I think, initially as physicians, we were a little hesitant when that advice came out, but it actually, as Dr. Mahamud says, you're stimulating these sort of very specialized immune response cells. So if you get one that has, this kind of response and one that response, it's possible that additive effect is better. So the fact that we can mix and match without untoward effect and possibly with increased protection is very helpful.
Thank you. Sumaida says, great advice. My sister just turned 18 in India where they've just allowed vaccination. Should she do the available vaccine or should she wait for Moderna to get approval in India? You already said, both of you said, don't wait for some magic dose that may come from somewhere. Go with what's available now.
Yes.
Yes.
Yes. Whatever she can get, the vaccine that goes into her arm is the correct vaccine.
That's a good way to think about it. Here's a comment and question from Norway. I was just in Oslo and met this Pakistani origin journalist in Norway. She's an opinion writer there, an opinion editor and writer. And so she says, from Norway, there's been a change for the better in the vaccine hesitancy? She's asking this question. Has there been a change for the better in vaccine hesitancy in South Africa and other African countries after the outbreak of Omicron? And how can we make richer countries give up their surplus stocks of millions of vaccines so that people in poorer countries can get their first jab?
Oh, Shazia, thank you so much. I think that's what we have been calling for constantly. If you watch our press conference, Director General Abdi, again and again, instead of vaccinating boosting young health people in rich countries, there are high-risk, vulnerable population, doctors who are working who have not received their first dose. So the investment and understanding that we are in together, and that is from economical, from moral, from social, as a citizens pushing our government, because we have a role, the media has a role, citizens have a role for that vaccine equity. In terms of Omicron impact it has vaccine hesitancy, I would say we have to look at the experience with Delta in the US or also other countries. When Delta came, we have seen those people who are sitting in the middle going. There are people who, whatever you do, it will still refuse. And there are others waiting for more data coming in. So when Delta came, it pushed a lot of infant sitters to get vaccinated. But by the end of the day, it is the healthcare worker, is the local leader who needs to listen to the people. There are genuine concerns from these people who are telling vaccine hesitancy, and no one wants to danger themselves. They have doubts. So sitting down and listening to them, it will require a lot of investments. So that investment from the local leaders, from their friends, from the circle, will help everyone, because it's almost, I put a slide from CDC. You can kindly show one of the slides on hospital admission, the nursing care. More and more people right now in our ICUs in our hospital are unvaccinated. So how do we protect them from misinformation, and from that will require support of everybody.
And I think this is where the medical community has really stepped up, because, I'm an ear, nose, and throat surgeon. I do lateral skull-based surgery, right? When am I asked somebody about their immune or their vaccination status before March of 2020, right? But every single patient I ask, are you vaccinated? Did you get a booster? If you are not vaccinated, what questions do you have about the vaccine? How can I help you answer those questions? And I think it does, as Dr. Abdi said, it's a very personal conversation between the person and somebody whom they trust, like their physician, their other healthcare worker, their religious leader, their community leader. I think these are really, we need to tap into those networks to ensure that people are vaccinated. We also have to get the vaccines to where the people are. I was reading an article about how, we need healthcare workers, we need vaccines in, let's say, sub-Saharan Africa, but we also need healthcare workers. We need refrigeration and freezers. We need to reach the people where they are, so that they are not missing crucial time from their jobs, so that they can continue to take care of their families.
Folks, we have just a few minutes left with Dr. Abdi, and we have so many questions coming in. Here's a question from Anita, who says, what evidence do we have that Omicron is or is not a positive move towards turning this from a pandemic to an endemic situation? Meaning, is this a sign of the end? On WhatsApp, there's a lot of talk that what is happening is a sign that this is almost over, that this is the end. This is how pandemics end, with a less lethal but very infectious virus. Is that true? And what do you know about that?
Thank you. I'll refer to that basic evolution. To start with, we don't know what is going on. I think when Delta came, everyone said, oh, this is the end. This virus doesn't have mechanism, and it surprised us with Omicron. I think it will require the humility, saying we don't know where this virus is going to take and going to go. Because predicting evolution, it's predicting what's going to happen, will be kind of hubris to do that. So the simple answer is we don't know, because I never anticipated from following all the variants we had, that a variant will come out with over 50 mutations, and 30 of them in the spike protein. How did it accumulate that? So nature will always surprise us. But what we can do is what we do with our evolution of our interventions. How much have we increased the vaccination in the most vulnerable, the booster doses in those nursing homes? Those are on our hands. What the virus does, it will do everything. So there's this, the triangle we always talk about. There's the pathogen, the person, and the environment. There are very dangerous pathogens out there that can kill very easily, but they are not exposed. So what we do as individuals, as a society, will determine how this pandemic will end. If we vaccinate 70% of the world across every country, I think we may shift this from the acute phase of the pandemic may end, and we can move slowly to that. But we have this unbalance going across the world, where the rich part of the world are boosting the young children, while in the other global south have not received their first dose. So we live in that unbalanced world that's giving the virus more and more chances. So I think it's long shot, But there's a lot of we can do with that evolution. The evolution of our response is in our hands. The
Thank you.
evolution of
By the
the
way,
virus.
Rafiq,
Yeah, thank
sorry,
you.
Rafiq's story. Thank you for the answer. It's helpful. I was vaccinated in Nairobi, your home capital of your country, where you're from, Dr. Mahmoud, with Sputnik. Now I'm in New York, where I will talk to my doctor to arrange for the booster. So, like Dr. Sujana said, whatever you can get in your arm is the right one. We have so many more questions that have come in, including via text and all kinds of things. I do want to ask one question that is an unusual question about. Mike is asking, how do you react to those who are promoting natural immunity communities or alternative health ways, Ayurveda, for example, in India and other things? What is your own attitude towards those, and what is the WHO stand on those?
I mean, we have to see health as a complex. So there's a role for all these ones. The spiritual need of our souls have to be filled. So I'm a firm believer all the other aspects are not mutually exclusive. You can do what you want, your natural, what you believe, as long as it's not harmful, and start with it. So for me, I'm a firm believer that the spiritual need cannot be ignored. There's a reason why we are homo religious. So if people believe in certain healing power of that has been demonstrated, but what we can do that can target this immediate enemy is called COVID-19, and that the vaccines and other available measures. So are not mutually exclusive. You can exercise, you can diet, you can do all those things to remain healthy. So to remain mentally healthy and to boost your immunity, do all the things that's required. Vaccinate, take your vaccines, take your pills, reduce your stress, sleep more, do all the other alternative therapy. That will make you a holy. So it's not a mutually exclusive that you can only do one. That's a linear thinking. It's a complex, and it requires complex solutions.
Dr. Sujana, are you as generous as Dr. Abdi is being towards people who are promoting the other ways of thinking about this?
So I think I believe exactly what Dr. Abdi said. I think the problem is people are promoting these sort of natural cures at the expense or while advising not to take what we know works. We know that the vaccines will dramatically reduce your risk of serious or severe illness or death. We know that the vaccines will dramatically reduce your chance of not just contracting the disease, but of spreading it to other people. We know in nursing home data, in elderly data, that this really saves lives. On top of that, yes, absolutely. Do your yoga, take your vitamins, do your pranayamic breathing, do all the things that make you feel well and do well, eat properly, control your diabetes, control your high blood pressure, but not doing a vitamin regimen and not doing the vaccines. And that's the point. It's not an either or. You can combine to get the best outcome.
I'll also say what makes me angry is that they are then promoting their own ideas at the expense of the ones that work, as we know, as Dr. Abdi said, the vaccine, the masking. That's so, if you have your own ideas, it's one thing, but then going actively attacking people who wear masks, people who get the vaccine is part of the problem. We're almost out of time. Devanshu is asking about India. Would we get the booster in India? Is there any planning for it? I'm not sure how much you've been tracking all the different countries and keeping them in mind, but what do you know about India, sir?
I haven't followed the India boosting program, but there's a lot of effort done in vaccination. I think one of the best. And India has a very strong immunization program. So I believe that the government and the scientists there are looking at it. But I want to bring again the boosters. It's those whom we missed with the first dose, even in India, rural India, when the first launch out, it was used to be registered online. So a lot of people in the migrant, people who are not educated, were not able to get. So it requires a lot of effort to reach people whom we have reached. So India with the polio eradication have learned a lot in Bihar, UP. It was those communities who are moving around. Unless we reach them, the disease continues. So the moment we reach the highest risk, I really want us to have a very high level coverage among the vulnerable, among the migrant population, among all those ones who will be most affected, and then we can go. It's not mutually exclusive, but there are people who are always outside of our micro plan. And so I will encourage the local government to do the extra effort to vaccinate the last 1%, 2%. It will require more and more effort to reach the most vulnerable. Thanks.
Thank you. Jan says thanks for your efforts to inform us. Renee says thank you for hosting this WHO event. Jonathan says important program with significant information. And Rahajan was saying that he is promulgating this via social media. Everybody, you have a friend somewhere in the world who would benefit from this conversation. Please tag them on Facebook, Twitter, YouTube, or LinkedIn, or hit share. They can watch it later. As soon as it's over, this will come on all of those platforms. You'll hear Dr. Abdi speaking again, even as he tries to get some rest after a very tiring weekend. I know how hard he has been working. We've talked. So thank you so much, everybody. Before we go, we want to remind everybody that Dr. Abdi has experience before COVID working at the CDC in America, where he came to New York to look at outbreaks of disease. And he also worked on the polio eradication program for Pakistan. And again, I keep saying I'm angry, Dr. Abdi. One of the things that you have learned is that vaccines work. Polio was eradicated, and now there are people who say vaccines don't work at all. So can you talk about that? And then we will wrap up. And I know Dr. Sujan has one more question.
Thank you. I think the biggest investment, public health investment or invention we did was vaccination. So we're able to eradicate smallpox 1979. Now we don't get any smallpox vaccination. Polio is almost eradicated. We have 2 countries, and there's a hope right now, the country and our colleagues. Dr. Hamid Jafari, actually, who helped the Indian government finish polio, is leading now the initiative in Afghanistan and Pakistan and that region. So there's a lot of optimism that soon Afghanistan and Pakistan will join the polio-free world, and the world will be in the next 3 years.
Are you saying they're the last 2 countries? I didn't know
the
that.
last 2 countries, yeah.
Oh, wow.
Yes, almost done in every country, the wild polio. So we're optimistic that those 2 countries will finish.
Pakistan and Afghanistan. Okay.
Yeah, and because of that misinformation, people in part of the world are spreading those informations and making people misinformation. If we can get rid of, I always joke with people, if there was social media, we would not have eradicated smallpox, although it was easy. So luckily we were able to finish before we had the pandemic of misinformation. So I think again and again,
we have to laugh, because otherwise we'll be crying all day. That's the reality of this, and that's why we're talking about this. Vasanti says, wonderful. Thank you for your great work you're doing. Unni says, thank you for your valuable answers. Dr. Sujana, you have a question for Dr. Abdi.
So, I just want to echo what Dr. Abdi said. I'm very proud of all my scars from all my vaccinations, because I didn't get any of those diseases. I have to tell you, I came to the United States when I was 5, and we had been vaccinated against measles, mumps, rubella, etc. And of course, we got some variant of measles and mumps again when we came here. But again, it had, we had those soldiers, right? We had those trained soldiers. So we didn't get very sick. I didn't lose my eyesight or my hearing, and my heart didn't collapse from getting those terrible diseases. One of the problems with COVID-19 is that, unlike polio, where you see a child go from healthy to infirm right away, we're not seeing this. This is a long-term where many people who are not in healthcare are not seeing the ravages of COVID-19. And I wonder, Dr. Mahamud, how, as the World Health Organization, we are educating people who don't see the immediate ravages of COVID-19 to stay with the program, to wear their mask, to get their vaccine, and to get their booster.
I think you brought a very excellent and the critical, that the people whom we lost, the 5 million and the more, it's already, we lost them. But millions, thousands and millions of people. We don't have the statistics of long COVID patients suffering the mental and the social impact of that. The very healthy friends of mine in the best form, 6 months down the line, I still have not been, will walk into the park next to them breathless. So long COVID is a major, major issue. So while it can be milder when you get it, the immune response that we are still learning is a really, really. So studies and more studies are showing vaccination can reduce long COVID. So don't take chances with COVID. COVID is not a simple virus. Get vaccinated, protect yourself, protect your life, mask, avoid mass gatherings, especially during holiday. We'll have more and more years to celebrate, but let's be very careful during this when we come together to celebrate. Thank you.
Thank you. And with that, we will let both our doctors go. I know Dr. Sujana is actually working today, and she's going to go see patients. So thank you, Dr. Sujana Chandrasekhar, who is co-host of She's on Call. Everybody, please tag that on your social media. Follow them. They do incredible work. Dr. Marina Kurian and Dr. Sujana Chandrasekhar, 11 a.m. Eastern on Sundays. You can see all their archives. So many great episodes. You had one just yesterday, Sujana.
Yeah, we talked about disadvantaged populations, so the Native Americans in the United States and pediatric ICU. But we've talked about a number of different healthcare issues over the last year and a half, and very proud to share that knowledge in an unbiased fashion with our viewers.
Thank you. And Dr. Abdi, what is your own attitude towards Omicron? Are you traveling? What are you doing in the next few days that you can share with us? And then we'll let you go.
No, for holidays, no, absolutely not. This critical, almost all the holidays have been canceled, and trying to keep myself and my immediate family. And
I understand that completely, of course. Well, thank you so much to both of you. And we will see you again, Dr. Abdi. I hope you will return in 2022. We'll meet under different circumstances in New York City, a city you know very well.
Stay safe. Thank you. And thank you for all the great work you're both doing.
Thank you so much for having me on, Sree. It was really, really lovely to meet you, Dr. Mahamud.
Same here.
Thank you.
Bye-bye.
Thank you.
Bye.
Thank you both. And I'm so grateful to both our doctors for being here. I'm grateful to all of you folks. Wasn't that really helpful and useful? So please share it right now. Tag a friend on Facebook, Twitter, YouTube, or LinkedIn, and they can watch us live, or, well, not live anymore, but later. As soon as I hang up, this is going to restart on all those channels. And you can go to my archives on youtube.com/SreeNet. We did 294 episodes, including a show every single day in the first 250 days. And we learned so much in the process. Thank you so much for being here, and please sharing. Here's Linda saying, thank you for a great show. Stay safe. Rajan says, thank you. I'm grateful for all you do. I'm grateful to all of you for watching. And there was a question here that we didn't get a chance to ask Sumedha. I'm sorry. I don't know if there is time, but about the HPV vaccine right after COVID vax, is that a fine idea? I hope there won't be any negative impact. This is a great question for your personal doctor. We always say that ask your own doctor because they know your situation the best. It's really, really important. I did want to show you folks that you're seeing, let me see here. That picture on the upper left is in 1994, my interviewing the then Director General of the World Health Organization, Dr. Hiroshi Nakajima. And I had a lot of hair then. As you can see, this was in Cairo in 1994, and shows you that I've been interested in this, in the topic of global public health for a long time, but I'm of course not an expert, and that's why we bring in all these great experts to help you understand these topics. Our shows are brought to you in part by Digimentors, the company that I run, I'm co-founder of. We would love to help you do a show like this, or a conference or webinar. Our company information is easily available at digimentors.group, Digimentors.group. We want to be your digital mentor. We also do social media consulting. We'd love to talk to you. Just reach out to me, Sree at Sree.net, Sree at Sree.net, or Sree at Digimentors.group. We would love to talk to you about helping you with whatever you're doing online. We want to be, as I said, your digital mentor. I'm also very grateful to my colleagues at the Stony Brook School of Communication and Journalism for encouraging these shows, as well as folks at Stony Brook University itself. And big shout out to our wonderful co-producers of the show, Rose Horowitz and Vandana Menon. This is the final show of this year, unless there's a more Omicron crisis. And we will be back retooled for the new year. We want to hear from you. Please reach out. Please get in touch. Please follow us on youtube.com/Sreenet. Please subscribe, and we would love to talk to you. And then finally, this is our QR code. You can, when I used to talk about QR codes, nobody knew how to use them at one point, and now everybody knows how to use them. So here's my QR code. If you'd like to get on my mailing list, get an alert when I am live, you can do that with this QR code. So just take your phone. If you're not on your phone, you're watching on your laptop, and please join my alerts so that we can tell you. I also started doing this right at the top of the pandemic, and I said, I will let you know if I get COVID, and I did finally. It was in August of 2021, and not at the beginning, so I'm grateful for that. Thank you all for being here. There's still comments coming in. Martina is watching from South Africa in Cape Town. Thank you. In 2018, I made an amazing visit with my family to Cape Town and to South Africa. Thank you for everybody in South Africa. You spoke up. Many in the world wanted to punish you for that, and that is completely wrong and unacceptable. And we are so grateful to everybody who's watching. Thank you very much. And I'll just put on the screen one final time our guest information. And he's on Twitter, so you must follow him on Twitter. Wasn't he so interesting? Dr. Abdi Mahamud, there you can see his Twitter handle is right there. Global Incident Manager for COVID-19. And he was formerly on the Pakistan National Polio Eradication Program. He's from Kenya, and he's also worked at the CDC. So we're very grateful to Scroll.in and Scroll Global for partnering with us on everything we do here. Thank you. If you're not on my newsletter, I hope you will join my newsletter. It's very easy to find, sreenet.substack.com, sreenet.substack.com. My newsletter this week was all about Omicron and saying that I've had it up to here with the unvaccinated. My trip to see my family after 2 years in India was from America in Goa, and Dubai was canceled because of Omicron. So we are upset about that, but we're also upset at the unvaccinated in America. The willfully unvaccinated are so upsetting, and I get very angry when I think about it. Thank you very much, everybody. We wish you peace and good health for the rest of 2021. And if you're watching this in 2022, thank you for watching. And please be in touch if we can help you with anything. We'd love to chat. Thanks and goodbye, everybody. See you soon.